Hey guys, my name is Dr. Yonas, and I'm here with Dr. John, and we are here to talk to you guys about plantar fasciopathy or plantar fasciitis. This is one of the most common ankle slash heel diagnoses that I see patients in physical therapy, and this video will help you decrease your pain so you can walk pain-free. John, do you want to introduce yourself a little bit?
Yeah, I'm Dr. John Schaefer. Kind of like Jonas was saying, today we're going to cover one of the most common conditions at the heel. This is something I see patients come into clinic with all the time. And it's something that's extremely frustrating because it can come out of nowhere. So we'll cover kind of what causes this condition. We'll get into some different signs and symptoms, how to know whether or not this is something you're dealing with. And then we'll get into treatment and next steps. So by the end of this video, you should have a pretty clear understanding of what this condition is, as well as what you can be doing to try and address it. So let's get right into it.
And the condition, most people call it as plantar fasciitis. But actually, the more correct term is fasciopathy, as it has to do with the fascia on the bottom of the foot. And it's actually the most common cause of heel pain in patients. I see a lot of patients with issues with their foot, ankle, but I see a lot of plantar fasciopathy slash fasciitis diagnosis. And some risk factors or things that'll make someone more likely to get it is if their ankle is more tight, if it can't really bend upward in dorsiflexion, if a patient is a bit more, if they weigh more, if they have a higher BMI, if their arch is very high or if their arch is very low, like if their feet are flat, and if they have a leg length discrepancy where one foot is longer than the other. And typically it's most common in patients that are between age 40 to 60. And in most cases, it'll get better over 3 to 6 months, but sometimes it can last as long as a year. And in most cases, patients don't go when they have mild symptoms of plantar fasciopathy. They normally go when it gets bad. They normally wait like one full year and then they see someone. And it's actually pretty common. It affects about 10% of the population. So most likely at some point you know someone that has it, or you probably did have the condition. And John, can you kind of talk about like what are some causes of it?
Yeah, we'll get into causes, but I was just wondering if this was your experience too. But what I've found is a lot of times we'll get referrals that just say plantar fasciitis or plantar fasciopathy, and that's pretty much a catch-all term that I feel like doctors are using. So it might not necessarily be that this is the condition occurring, but patients are being told that this is what's happening. So that's why it's super important, at least I think, that you've got a really good understanding of this is actually what's going on.
That's a very good point because sometimes if we treat the wrong diagnosis, the patient will take longer to get better, or they may not get better. Who knows? So
Yeah,
it's easy
exactly.
to know.
So we'll talk a little bit about causes, and I think it's very, very helpful to just have a profile of what, this person looks like. So again, kind of 40 to 60 is that prime range. So if you're within that range, should raise some questions if you do have heel pain. So this condition is typically caused by abnormal biomechanics at the foot. Basically, all that means is the foot's not moving in the ways that it's supposed to. So there's a certain degrees range of motion that you should have throughout the foot, and there's certain ways that the foot should move as you walk. And when that's not occurring, that's when we can start to run into some of these issues. And what happens when the foot's not moving as it needs to, there can be resultant micro tearing, degeneration of the plantar fascia, secondary to inflammation. So that sounds kind of scary, but all that means is that when the foot's not moving quite as well as it needs to, some of those structures get a little bit angry. The foot structure itself, anything that affects the arch. So if you've been told you have flat feet, you've been told you have high arches, those are buzzwords, especially in the orthotic world. And so if that's the case, if you do have some of these different anatomical variants, this can predispose you to having plantar fasciopathy down the road. Other conditions are potentially, or other factors are shoes with poor arch support. So if you do have issues with the arch and that arch is not supported adequately, that can further lead to issues at the foot, at the heel, and then also exercising on hard structures. So if you're walking on concrete all day, playing basketball on cement courts, I know pickleball is extremely popular nowadays. All those can be factors because if you're constantly spending time on those surfaces and you don't have good support, that can be awful hard on some of those structures. So Jonas, go ahead. Let's talk just a little bit about signs and symptoms. Do you have anything else to add for causes?
Yeah. And I think a lot of times it's good to think about when we bought our shoes and the time frame that we had our shoes, because a lot of the times if a shoe looks nice on the outside, we just keep it like for 1 year or a year and a half, and the shoe gets worn down over time. For example, this summer I went to Europe for 2 months. I bought a new pair of Brooks, and I only took one pair of shoe. But at the end of those 2 months, they were worn out because I did everything. I went jogging, I climbed mountains just in those pair of Brooks, and they were worn out. So by the time I was done with Europe, I needed a new pair of shoes. And a lot of times, if we don't do that, it can put more pressure on the bottom of our foot if the shoes don't have the right support.
Yeah, so
Yeah.
I think an easy way to do that then, so even if it looks good on the outside, just flip the shoe over and kind of see if how much wear there is. Is it flat? Are there still some good ridges, things like that?
Definitely. And next, we're going to talk about kind of the signs and symptoms. So to know what it feels like when you have plantar fasciitis or plantar fasciopathy. And one common test that we do in physical therapy is called the windlass test. So when you're standing with your foot flat, and if you just pull up the big toe, and that'll create more tension along the plantar fascia area. And if you have pain, you possibly could have plantar fasciitis less fasciopathy, and that's a common sign. But some common complaints of this condition is when you wake up in the morning and you have pain with the first steps in the morning, or if you have pain when you sit for a long time and you suddenly get up to walk, and also just with prolonged weight bearing on your feet. Those are common. And also, if you have decreased range of motion in dorsiflexion passively and actively. So passively means if you move it, if somebody else moves your ankle, and actively is if you do it on your own. And typically there's tenderness on your heel. So if this is my heel, there's typically tenderness at the front of the heel. And those are about the signs and symptoms. Do you have anything else going on, John, before we jump to the treatment of this?
No, I think that's all great. And just kind of a reminder, so plantar flexion again is pointing the toes down and the dorsiflexion is pulling the toes up. Um, but no, I think you did a good job covering everything there. You can perform the windlass test at home too if you just sit with one leg crossed over the other and pull your toe up. If you do it in clinic, the therapist might have you stand on a box, but really that's just kind of examining again how much tension there is underneath. So that can be a pretty good indicator.
Oh yeah.
So we'll start to get into the treatment here. Jonas, if you have anything to add as we go, just feel free to kind of jump in here. But the first thing we talk about with any kind of injury you're experiencing is always activity modification. So this doesn't mean stopping activity altogether. I think a lot of times we'll see healthcare providers, doctors, I think, are at fault in some cases where they'll just say stop doing everything altogether. That's a little bit of a red flag. So there's always ways you can modify your activity. So if someone is telling you to stop altogether, feel free to see a physical therapist or someone like that, because they will empower you to find ways to continue to move. So first things first, find ways to continue to move, find ways that you can stay active despite the heel pain. So maybe that's just decreasing your levels of activity a little bit, or maybe that's finding other activities that, aren't as painful in the moment. But really, the biggest thing that's going to make a difference with this condition is focusing on mobility. So, in the calf, we've got a couple different muscles. You've got your gastroc and your soleus, and those two make up your calf muscles. So, stretching the calf is going to make a huge, huge difference. But it's important, or at least what I've found, is to work in positions like standing and seated first. So thinking about doing like a runner stretch where you've got your hands against the wall, one foot in front of the other, stretching out the calf. You can also do something like where you're in sitting, wrapping a towel around your foot, kind of pulling your toe towards you. And then eventually, what you can do is progress towards something more aggressive, like a stair stretch. So, what that would look like is you're standing on the bottom, maybe bottom step, and then you're letting your heel kind of sink below the step. That can be a little bit aggressive if that's the first thing that you're starting with, and can lead to a little bit more irritation. So, just be mindful that when you are stretching, that you're taking things slowly and not irritating things too much. The next piece is focusing on manual therapy directed at the joint. So if you if you just do a simple Google of plantar fasciitis exercises, I feel like the thing you see the most is freezing a water bottle and rolling it on your foot. Um,
Everywhere.
I'm not sure why that's been the gold standard, but it is something that can be helpful. The cold can help a little bit with inflammation in the area, and then just the rolling motion back and forth can help with a lot of that tension that's in what's called aponeurosis, or the tissue underneath the foot. If you want to do the same kind of motion, but you don't necessarily want the cold, what you can do is take a lacrosse ball, foam roller, anything like that, and just put it underneath your foot, move it around. When I've dealt with this in the past, I've used a golf ball. That's worked pretty well. Most
That's
patients,
intense with a golf ball. That's definitely more intense.
yeah, a little bit smaller and harder too. But you'll find I'm sure you've got something around the house that you can use to roll around your foot. If you are in clinic, your PT might use tools to scrape the fascia, scrape the bottom of your foot, and they'll also likely work on some joint mobilizations at the ankle and the big toe. Some of these things you can do again at home. If you want to take a butter knife and some lotion, you can scrape the bottom of your foot. That's something that I've recommended and seen some success with in the past. And you can also do some mobilization of your ankles by yourself, just moving the foot back and forth. If you do have pain with the first few steps in the morning, that's one of the biggest signs really when dealing with these conditions. Um, your PT might recommend using a series of night splints. So doing that for about 1 to 3 months can be something that's helpful guidance. Again, will kind of depend on your specific situation. But if you're trying to self-treat or something like that, you could look at potentially ordering a night splint.
Yeah, and then with a nine splint, it's just like a sock, and it applies the foot and ankle in a light stretch in dorsiflexion overnight. And you don't want to make it too aggressive, or else you won't tolerate it. So the goal is just to get like a low load, long duration stretch to affect the ankle, definitely. And I have seen good success with that. You just don't want to make it too intensive a stretch, or else you can't go to sleep with it on, and you'll feel it. But over time, that should become easier.
Yeah, and I think that's a really good point too, because most of us, when we sleep, our foot kind of drops down a little bit, and that gives
Yes.
the opportunity for all that tissue to tighten up. So if you're keeping it in more of that dorsiflex or bent up position, you're not giving those tissues opportunity to kind of shrink up overnight. The next thing we'll talk a little bit about is orthotics or shoe wear. So these are just like the inserts you put in your shoe. They're not typically recommended for short-term pain relief. So this is something where if you are getting orthotics, they can be helpful in the long run, but don't necessarily expect that, getting a new insert is going to be a quick fix. And orthotics are typically recommended for people who have success with taping. Jonas, do you want to talk just a little bit about taping? Have you used tape?
Yes. Yep. So some I use this on some patients, and you can place tape on the bottom of the foot, and that can sometimes distract you from pain and even improve your proprioception or your body awareness of your foot as well. And that's just a temporary thing that you can put on to make the foot and ankle feel better with plantar fasciopathy or fasciitis. And then typically, if someone does do well with taping, they'll most likely do well with an orthotic.
Mhm.
That's what I've
Yeah,
seen.
and there's also different taping techniques that you can use for the calf, for the Achilles, to help just with mobility and things like that as well. Additional treatments that we can look at also include things like heat, dry needling, laser therapy. These things are a little bit more passive, meaning that you're not necessarily actively seeking to improve this condition. You're just using things that maybe feel good, or something, or someone else is doing something to you. So these can be helpful in adjunct or in addition, but wouldn't necessarily recommend as being the only thing you're doing to treat this. Ultrasound in the past has been extremely commonly used for heel pain. There's not a whole lot of evidence to show that it makes a huge difference, but it is still something that we're seeing doctors recommending.
Uh, and I did read that as well. I read that the extracorporeal shockwave therapy, which is like intense ultrasound, there's like a little bit of research that says that that does help out. So it's like a stronger version of ultrasound, but I've never used that before. I just also read that online on the current concepts book. It was interesting.
Gotcha. Yeah, just be wary of, anytime someone's offering different modalities, just gotta be a little bit careful with those and make sure you're still being active.
Oh,
Um,
yes.
just a few other things here. So weight loss may play a role um, improving this condition. So just thinking about if you're carrying around less weight, it can always make things a little bit easier on your joints, a little bit easier on your tissues. But it's just one factor at the end of the day.
Yeah. And I feel like with our the essentially the more that we weigh, the more we put pressure on our joints. And if someone takes 10,000 steps per day, right, it's like every time they take a step, they're putting their full body weight on their plantar fascia, on their foot. It's like step after step after step after step. And it can get tired over time. And the lighter we are, the less pressure we'll put on our weight as well. And especially if you run, right, then that puts more pressure. If you go up a hill, that puts more pressure. And so it just depends on the level of impact. But let's say if someone weighs 300 pounds versus if someone weighs 150 pounds, you're going to put a lot more weight on the 300-pound person. So it's really important to work on your mobility and your strength as well, which I'm sure that we'll talk about that as well.
Yeah, and then kind of one of the last pieces here. So we talked a lot about stretching. We talked about different, modalities you can use. We talked about orthotics, but really one of the biggest pieces in seeing long-term success with any condition is figuring out how to correct any strength deficits and things like that, so you can make sure that you're strong for a long time to come. When it comes to the foot, it's very important to strengthen what we call foot intrinsics, or the little muscles that sit between your toes, underneath your foot, really all over. It's an area that's I think largely maybe overlooked, just because most people think, okay, I'm walking a lot throughout the day. Like, how the heck else am I supposed to strengthen my foot? There are a lot of specific exercises you can do to help strengthen those muscles that will make a big difference in the long run, so that you're not dealing with something like this again. So things like towel scrunches, where you're putting a towel underneath you and then kind of curling your toes into the towel, can be a good one, as well as toe yoga, where you're isolating different toes. Can be pretty challenging, but something that's effective over time. Are there any other exercises that you like to recommend in terms of just strengthening the foot?
Yeah, one good stretch, you kind of mentioned it, is the runner stretch where you're against a wall. You put let's say if your right foot is the painful foot, and you put that behind the left foot and you keep your foot down flat. But another tip is to put a towel underneath the front part of your foot, and that'll target the plantar fascia more. So just by placing a towel underneath the top front of your foot, so your toes are a bit more upward, and also just raising up your heels to build up the calf muscles. That's important too, and even placing a towel underneath the top part of your foot as you're doing that. But those are pretty much all the good exercises the answer before. Some other treatments that are not as common that we as physical therapists don't do, but some prescribe them, is actually surgery. And I've never seen a surgery for someone with plantar fasciitis or plantar fasciopathy. It's a plantar fascia release. That's not common at all, but that's another option that a surgeon might prescribe. But most don't do that because most get better with non-surgical
Yeah.
methods. And also some physicians might do injections as well to the plantar fascia. And I've I don't think I've ever met a patient that did have that too. And injection, over time, it can cause weakness in your tissues as well. So it's definitely not a good long-term play. But it's just something to think about if you have no success with the non-conservative messages, treatments.
So really, I think the main takeaway here is, if you have this condition, it's going to get better. This isn't something you're gonna have to live with forever. But there's just a couple different routes and a couple different approaches you can take if you are dealing with this. It's something where, sure, you can wait it out for a year, 6 months, a year, see if things get better, or you can see a physical therapist and actively take, an approach to make this thing better a little bit quicker and have a better understanding of what's going on, your specific timeline, all that good stuff. If you do have any specific questions about plantar fasciitis, fasciopathy. It's been a tongue twister all day, I feel like, for both of us. But go ahead and drop those questions in the comments. We're more than happy to answer them, as well as if you want to see any other videos on topics around heel pain, the ankle, or any other joints. Anything else to add?
No, I'd say John and I, we made a pretty detailed list of the condition and treatments and causes, and just ways to get rid of it and ways to identify it. If you'd like that, just comments plantar fasciitis, and then we can share this document with you for free. And make sure to follow John on YouTube. And where can people find you, John? Because this will be posted on both of our pages. Where can people find you?
You can find me at, so I post on Instagram at johnschaefer.dpt, and then I'm also on YouTube at, I think it's just John Schaefer. You can look up John Schaefer physical therapist and it'll be one of the first pages. And then how about you, Jonas? Where can people find you?
You can find me on Instagram and YouTube at Dr. Yonas PT.
Perfect. Have a great day, everyone. We'll see you on the next one.